Hi, my name is Jaden, and welcome to Living with CCI, Craniocervical Instability. I received my CCI diagnosis late last year in 2022, but I've been dealing with this for a long time. I noticed the initial symptoms about 10 years ago. This is my third video on this topic. The very first video I talked about how I think I got CCI. It's a bit of a mystery to me, even still. Some of the conservative treatments that I did early on, and in my second video, which was the previous video to this one, I talked about my more aggressive approaches to treatment, including quite a bit of discussion about regenerative medicine. So where I left off last time is I told everyone about my experience getting my first PICL. The PICL procedure is probably the most advanced treatment available for people with CCI that are not wanting to get a fusion surgery. So I don't know if I've talked too much about surgical options just because I never really considered it in my case. I'm fairly high functioning. I'm still working. I just have chronic pain that is pretty constant. It's a moderate level of pain, I would say. But it's very debilitating. So it's taken me a while to adjust and adapt, and I feel like I've done fairly well with it. So part of the goal of this whole series and what I want to get to when I'm sort of finished telling all the background is just living with CCI, and that I've been able to make some adjustments that have helped me, and they may not be applicable to everybody. I acknowledge that I do not have some of the worst symptoms of CCI. I basically have headaches, neck pain, joint issues in the upper neck, and that's about it. I don't have the dizziness or the vision, blurry vision, the brain fog, or any of the other sort of neurological symptoms that some people with CCI get. And I think people that have a whole constellation of symptoms that are finding it difficult to function, those are the people that are really, they struggle the most with CCI. So I'm a different kind of case, and I'm just wanting to acknowledge that's the case. Like I don't represent, by no means I represent everyone with CCI. It presents very differently for different people, which makes it interesting but also hard to treat and hard to diagnose. So I left off the last video with the PICL number 1. That was at the end of a lot of investment in regenerative medicine and the promise of stem cells and what they can do to heal damaged ligaments, which is essentially the cause of CCI. Ligaments keep joints in check. Ligaments keep joints from moving further than they're supposed to move. When ligaments are damaged, the problem is that the joint will move too far, and the joint will start to get damaged itself, which leads to all kinds of other symptoms when you have joint damage, like nerve problems, which is what I have with occipital neuralgia in the back of my head. And you also get a lot of muscle, myofascial, I guess, problems, because when ligaments are weak or failing, your muscles have to take on the additional workload of trying to keep the joint together. So that's kind of what makes it a chronic issue, and that I don't have, a fracture or something in a vertebrae that's causing this instability. I just have ligaments that are probably have extra laxity or just basically too loose. And because they're too loose, the joint moves a little bit further than it's supposed to, and it causes all these ongoing issues. So regenerative medicine, the promise of it is that you're able to in a very targeted fashion go in and add a substance from your own body, and whether it be stem cells, which in my case came from bone marrow, a concentrated sort of version of the cells in bone marrow, or PRP, which comes from blood. But it's material from your own body, and it's put back into you in a modified form. I should, maybe modified is too strong. It's not, it's concentrated, I think is a better way to say it. It's not any kind of genetic or, crazy stuff like that. It's basically just taking something that's already occurring in your body, helping it along a little bit, and then putting it back in a very targeted way. So, unfortunately, after my first PICL, I had very high hopes. I try not to have high expectations for things, especially when it comes to medical treatments. But I was very hopeful, and I think in the last video I said I was a little disappointed. Well, I was very disappointed. I really didn't feel better. I think that I might have had some small honeymoon period after the procedure where I thought I felt better, but I very quickly reverted to my baseline symptoms. I was not happy because I had been through so much. I had been through many, many years of pain and being undiagnosed, and then, chasing after different things that were seen in my imaging that, led me down a lot of wrong paths. There was a lot of attention paid to a disc bulge that I have at C5-6, which really is asymptomatic as far as I'm concerned. My issues are upper cervical, and it took me a couple of years of dealing with doctors and spending money and to kind of figure that problem out. So I was finally getting treated in the right area, and I was finally getting the right treatments, but unfortunately they weren't working. So it, sucks to be me, I guess. But, I always am forward looking. I try to, learn things, everything I do, and just move on. And, there's no sense, living in regret or anything like that. So what I remember about post PICL1 is that, definitely within a month after the procedure, I was already starting to be like, okay, what's next? Because whatever they did to me was not helping. And I told the doctor that, and I was told to be patient, which is a little hard to hear when you're, fighting this condition for years and years and years, to be patient. But I did listen to it, or I tried to listen to it. I also explored some of the chiropractic options for people with CCI. So I'll talk a little bit about that in this video. I think I'll have time to fit it in. I looked at the Chiropractic Biophysics at that point. It's something that when you get a PICL, you'll get a little handout. At least I did, and I don't know if they've changed it or not, but you get a post-procedure handout, and one of the things they recommend is if you have loss of neck curve, which I do, I have a straight neck basically, and knew that from my first x-ray, that you look into this Chiropractic Biophysics, or CBP. It is a specialty form of chiropractic care that is aimed at trying to restore the curve in the neck. And so the neck is curved so that it can withstand more impact, and it's kind of designed to act more like a spring rather than a broomstick, basically, that doesn't have any give to it. So in my case, my neck is like a broomstick, and so if I run or if I do any kind of impact, it will put a lot of pressure or just a lot of force on all of the joints in the neck, and can cause a lot of issues. So I went ahead and I was actually pleasantly surprised to find that within like half a mile of where I live in Los Angeles, there's a guy that does chiropractic biophysics. So I was like, okay, well, this is just meant to be. I got myself enrolled in that, and I told him about the PICL, and lo and behold, he also actually had a DMX in his office. I've talked about in the last video, the DMX is one of the more common ways of imaging for CCI. It's a video x-ray system. So I was like, great, this guy will be a pretty good resource, and he's like down the street, literally. So I was happy about that. The other benefit of it too is he was actually, I was able to get quite a bit of that particular care covered by my insurance, which was nothing short of a miracle, because found that when you have a condition as rare as CCI, you almost can just ignore your insurance network, because generally speaking, whatever specialty care you find, it's not going to get covered. So in this case, it was covered, and it was nearby, and it seemed like he had some knowledge of people with these kinds of more niche issues with the neck. I wouldn't say he was a CCI specialist, but he was at least aware of what the PICL was. He was certainly aware of the DMX system that is out in Colorado that is used by the clinic that does PICL. So he had some understanding, maybe less than I did, but whatever. I mean, at least he wasn't completely green to what CCI was. So I did that. I sort of used up whatever benefits my insurance offered. I didn't find that it really helped. I mean, Chiropractic Biophysics, it was sort of this hour-long chiropractic appointment where you go in and, like in this particular clinic, you sort of lay on a heating pad or something. They just try to like relax you, I guess is the idea, relax your spine. And then you get an adjustment, which in my case, I'm like, you're not adjusting me, because that's a no-no for anyone with CCI. And he understood that, so he would do gentle touch things. I think he did adjust my back a couple times because I was comfortable with that, but I was not letting him do any high velocity adjustments of my neck, because that could make my ligaments worse, and I don't want that. I don't want any of the horrible symptoms of CCI. So there was an adjustment, and then you get put on a couple of different machines, or I don't know what you'd call them, like apparatus that they have at these chiropractic biophysics clinics. One of them is kind of where you hang in a, there's like this loop thing, and you're just kind of hanging there, and they're trying to get you, basically just exaggerate the curve, I guess, in your neck, and they're just using a little bit of gravity and some counterweight, and I don't know, the whole thing seemed a little hokey to me. It's like, yeah, okay, like hook this up in a basement or something, like, but anyways, they had this set up, and you sort of went into that for, they put a timer on, and you sort of hung in this thing for a while. And then they also had a spinal decompression machine. I had used those before, as one of the many other things I did in search of treatment over the years. So decompression is just this machine you lay supine or flat on your back, and it sort of grabs your head, and it just sort of ever so gently just lifts it up, and then brings it back down, and then lifts it up, and so on. And so you sit in this thing for a while, and it kind of just tugs away at you. It's very, very gentle. It's very, very safe. And I think it's just meant to help the muscles kind of give up their spasms and be like, it's okay. You can chill out, and I think that's kind of the idea of it. And then the last thing that they had me do was some exercises. So I was like, well, that's actually kind of interesting, because I've never before in my life been given exercises by a chiropractic practice. So I had to do these exercises, and they made me do them while I was still over there, which was good, because as many of you probably find, it's hard to sometimes do all your exercises when you're left to your own devices at home. So that was my experience with chiropractic biophysics. And I really only did it because it was recommended in writing by the clinic in Denver that gives everyone the PICL. And I thought, okay, well, if they're recommending it, it must be something I should do. And the last thing I can say about it is they do these sort of before and after x-rays at the chiropractor's office. And they try to sell you on like, oh, your curve increased by, 12% or whatever, like 3%, or I don't even remember what the number was, but the whole thing just seemed a little bit of a sales gimmicky thing. Like, okay, it's nice that they have measurements, I suppose, but I don't know how accurate those measurements are. Like, has any of the stuff been, studied with just large populations of people. Like, I don't think so. I think they're just sort of measuring it and showing you, and I think it's a little bit of smoke and mirrors. But again, this is all my opinion. I'm not dissing the body of work that's gone into developing chiropractic biophysics. My impression of it as a consumer is that it's kind of presented as it's a little smoke and mirrors. He did say that my curve did improve, so I guess I got that out of it. Although I may have undone all that progress because I haven't seen the guy in 2 years. So, okay, so that was my chiropractic biophysics. Didn't really help me, but it was covered by insurance, so I was happy to sort of exhaust whatever benefits I had, and then I just sort of stopped going. So that was the story there. And then I think the other thing that happened during this period is I was getting more involved in the Facebook groups. And I probably need to rant a little bit on that as well. I'm super appreciative of the people involved in setting up these groups and moderating them, because people with CCI are very isolated. I mean, we're spread out all over the place. There aren't very many of us, in terms of the general population. And there's just not a lot of resources. Like there's not enough education and not enough doctor or physician awareness. So the Facebook groups are really helpful. But they're also, huge rabbit holes. And I just encourage anyone that's getting involved in them just to, just be aware of that, like that you really shouldn't be diagnosing things based on what you read on a Facebook group. I think that, you either have to become very, very educated yourself and then add on like talking to a medical professional and comparing notes that way versus just chatting with people on Facebook. Again, just my opinion. Free to do what you want, but I was a little bit like, whoa, when I first saw these Facebook groups. But there is a Facebook group that is specific for people that have had PICL, or I believe they accept people that are considering the PICL as well. So I really do recommend that one. The moderator of that group is very vigilant and careful with what is posted there, and not saying he censors anything, but he will comment if he thinks something's out of place or disagrees with something. So that's a particularly good one. And a lot of people there were fanatical about Atlas Orthagonal chiropractic. So that's one of the other flavors of chiropractic care that is specialized for the upper neck, which again is CCI is an upper neck problem. So it's an option that a lot of people use, and it's often abbreviated AO. So if you see AO chiropractor, that's what that means, Atlas Orthagonal. It was a technique developed not that long ago. I think the doctor was in Atlanta. I believe he might even still be alive. So that's how kind of recent it is compared to chiropractic in general, which is very old. But yeah, so Atlas Orthagonal, it's essentially a certain it's a very specific table with a machine that will adjust your C1 vertebrae. And the reason that they use a machine is to make it very precise rather than using their fingers and thrusting from their fingers and their arms. They're using this actual machine, and the machine has like a little they call it a stylus. It's it looks like a metal pen basically, or if you use like a tablet or whatever, you might have a stylus. So this adjusting machine has a stylus on it, and then it has this kind of protractor angle that measures the different angles, and so the chiropractor will determine what vector your atlas needs to be pushed, and they'll dial it into this device, and then the stylus will give you a little tap on your atlas, and that's the theory of AO. I'm sure that a chiropractor would do a much better job of explaining it, but that's what I understand about it. So on this, I had a very interesting experience receiving AO chiropractic. So I'll try to be as unbiased as possible. But I hope not. I don't come across as being as being too jaded. But anyways, so there aren't very many AO chiropractors in the U.S. and there's probably very few, if not any, in other countries. So it's a small discipline of chiropractors. There is one that I'm aware of, or maybe two now, in the Los Angeles area. I mean, and that's like an area of over 10 million people. And the one nearest to me is about an hour away. And I don't drive as a result of CCI, which I'll get into in another episode. But I 3 years ago decided that I was done driving. I just found it too awkward and painful, and it was too hard to adapt, to have enough support for my head while I was driving. So I was like, okay, well, this is a big commitment if I see this AO chiropractor and it's like 2 hours of driving for one adjustment. But the more I was discouraged by the PICL not really working, I thought, well, I'm going to have to find something that will help me function. So I made the appointment and sort of got all the pricing information, and I was quite, I was happy that it was a la carte pricing, meaning that you pay per visit. A lot of the chiropractic, when you get into this level of specialty, they will sell you a large package of stuff for, X $1,000 rather than selling you, or rather than just having you pay per visit. But the AO was like more of a traditional appointment fee system, which I thought, okay, well, that's good. So went down there. The first thing you have to do is get all of these x-rays, because they use the x-rays to determine the vector that they're going to push your atlas in. So I had this appointment that was designed for people that don't live in the area, where you can go down and basically get all these x-rays done and the sort of intake assessment from the chiropractor, and get the first adjustment, all in one. So I'm like, okay, sign me up. So I went down there, had all that done. The guy was very competent. He was older. It was probably the most religious medical experience I've ever had in my life. But that's okay. I mean, I don't mean that in a negative way. It was just a little jarring to have every room have, religious kind of symbols, and to have the doctor praying when he was adjusting me. But if it works, I support anything that works. So that's what I told the guy. I mean, I'm not a religious person myself, but if the treatment works, great. It doesn't bother me. That's all I'll say about that part. But okay, so yeah, I had the first adjustment, and I would say it actually really it really helped. I was quite taken by it. I thought, wow, okay, this is pretty amazing stuff. So he wanted to see me within, I think, 3 days, because they have when you receive the first few adjustments, they like to sort of monitor you and all that. So I was like, okay, well, I'm definitely willing to do all this driving, which I ended up having to rent a car. It was just the cheapest way to do it. And I have a cervipedic that I can kind of tie to the seat, and it's not ideal. I'll show in another episode how I drive when I have to drive. But I rented a car, and I had my makeshift, neck support and all of that, and I did a few additional trips down to see this chiropractor, and yeah, I was like, okay, well, maybe this is my way through this, and if maybe eventually I won't even have to go that often, and all of that. Anyways, long story short with this stuff, like so many things that I've done, and even medications that I've tried, that I've done a lot of things that work the very first time. I get some benefit, everything kind of relaxes, and I feel great, and my symptoms become diminished, and I'm really excited about it. And then my body seems to figure things out, and it just reverts back to the, you know, the bad place that I was in before. So essentially the same thing happened with AO chiropractic. I ended up really not benefiting after that very first adjustment. I kept going. I thought, okay, maybe I'm just, you know, maybe I need to go more consistently. And of course the doctor is very enthusiastic about that. And like, I always have that consumer mentality of like, okay, are they enthusiastic because they want, you know, recurring business, or are they, you know, I believe that they actually want to help, you know, but I don't know. I'm a little, I'm a little skeptical. I guess that's just me. So, yeah, so I kept going and I kept paying, and I kept not really getting any benefit, and it was really hard to get there. So I took a break, and then it was at that point actually that I had my follow-up with the PICL doctor. And so I was telling him, you know, how I was doing, and, you know, it was a Zoom or like a video visit for follow-up. And, you know, first thing he asked me is, you know, like, how are you doing? Are you feeling better? I was like, no, I'm not feeling better. And I could just see in his face that, like, the appointment was over. Like, he, you know, that's really all they wanted to know. Like, is it working or not? And, yeah, he, you know, he gave me a couple other, he's like, oh, maybe you should try some posture, stuff. And he referred me to some physical therapist that I actually did end up doing a bunch of sessions with, because, like, I don't know, what else am I supposed to do? So yeah, he did recommend some work on posture, because I think he saw me, like, in the video, like I must have, like, not been in my best posture or something. So note to anyone, if you're doing a phone call with one of the PICL doctors, like, mind your posture while you're on the, you know, 8-minute call with them, because otherwise they might send you off to physical therapy for some posture retraining, which is what happened to me. You know, it's all optional, of course, but I mean, like, I just, anything that works, that's my mentality. It's like, if it's helpful and it works, then I'll do it. So I kind of digress. So I was telling you about AO chiropractic, and I'd had the PICL follow up, and, you know, that doctor was really discouraged, and I had taken a break from the AO just because I got tired of driving down there. And I don't know, I got into this level where I was in a bit of a down spiral in pain. And I thought, okay, well, I'm going to go one more time down, you know, to the AO chiropractor. And, you know, I'm in a lot of pain. So, like, I feel like maybe if I go and do that, I'll have a similar kind of, you know, wowing effect that I had the first visit, just because it's been a while. I think it had been a couple months or something. So I went down there, and this was where AO just kind of, it just kind of ended for me. I went down there, and he was really pleased to see me. He was like, oh, like, you know, you shouldn't leave it this long between sessions. And I was like, oh yeah, I had some other things going on. I kind of lied a little bit because I didn't want to insult the guy. I mean, he is adjusting my neck after all, right? So yeah, so he gets me on the table, and then one of the things that a lot of these upper cervical chiros love to do is they check your leg lengths. I don't know. I don't really understand I'm assuming there's some kind of geometry to do with leg length and hips and the top of your spine, but apparently there is. So they check your leg lengths, and that's how they determine, like, whether you're in alignment or not in alignment at the top of your neck. But you'll get that if you go to a NUCA or an AO or probably other chiropractors as well. So yeah, so I lay on this table and I feel like crap. Like I was in pain, like, for several weeks, and then I just driven down there, and I was like, okay, I'm going to get an adjustment, and I'm just going to, like, I'm going to pray with the guy this time. Like, even though I'm not religious, I'm going to pray with him that something works. And you know what he says to me? He does the leg length, and then he sort of, like, comes up and feels like the muscles around the back of my head. And he's like, you're doing really well. You're in alignment. Like, I don't even need to adjust you. No, I think you should just, stay, or like, basically he didn't recommend doing any adjustments. So I was like, oh, okay. So I've been in pain. I came all the way down here and I'm not going to get adjustment. I don't know. Maybe I don't, I just didn't say anything to the guy. I probably should have pushed back a little bit on that, but I just sort of thought, okay, well, if that's the way it's going to be, then I'm going to get up off this table. And I went to the front and she's like, oh, that'll be $150. And I'm kind of like, really? Okay. And I paid and I'm like, okay, that's the last $150 that you're going to get. So that was the end of my AO experience. And I know there are many people probably watching this video that are going to be like, oh, you need to go back again. And like, it's like, I don't want to belittle AO. I think it really helps people. I'm just sharing my cynical experience, with a really good doctor who I think really knew what he was doing and really believed that I didn't need to be adjusted that day. And maybe it's true. I didn't need to be adjusted. And maybe AO was just not for me. And his policy was that, if you go down for an appointment and you occupy his office and you're laying on his table, like, you have to pay the fee. And I get that. I mean, it's business is business. And I did pay the fee. I didn't just run away and refuse to pay the bill. But I wasn't really in the mood to be going back and doing 2 hours of driving to be not adjusted and charged $150. So, okay, so hopefully that'll be the last rant of this video. And where was I? So I'm going to talk a little bit about what happened with the sort of conclusion of PICL 1 is I had that, I guess it would be called an interim follow-up that I described previously. I think that was at month 4 when it was a very short appointment and the only thing was like, are you better or not? And then, no, okay, I don't need to hear anything else. Like, I was not better, so that's all he needed to know. And then he sent me to the physical therapist for posture work, which I did as a good boy or whatever. I went and did my posture work with a clinic that at the time did Zoom visits with a lot of patients from that clinic. I think they now have their own internal physical therapist at the clinic that does PICL, but at this time it was like an off-site clinic, but the guy did Zoom, so I'm not going to Denver for these things, for the physical therapy, that is. So I did that, and then after that I just kind of waited until month 6, which is when he saw me again, maybe it was like month 5. It might have only been a month, but we had that short appointment, and then I had another one, and I'm not sure what he was waiting for. Like, maybe I would get better in 1 month, or maybe it was 6 months. I don't know. But so I had this sort of final PICL 1 visit that was another virtual visit, and it was the same thing. He's like, how are you doing? Do you feel any better? I was, no, I don't feel any better. It's like, really? Like, even a little bit? I'm like, no, I don't feel any better at all. Sorry. And he was like, he started thinking, and I'm like, okay, well, this is good. So he hasn't ended the call yet and gone on to his next visit. He's thinking about what he's going to say to me, and I'm just sort of patiently waiting, looking at him on the screen, and he said, okay, I want you to come out here in 2 weeks. And I'm getting excited because I'm like, oh yes, I'm going to get more treatment. I've been in pain, and I've fired all my chiropractors, and they don't want to see me anymore. I mean, they would have seen me, but I didn't want to see them. So he was going to see me, and I'm like, okay, what are you going to do to me in 2 weeks? And he's like, and this is where I don't know, the story just gets weirder. So he said, I want to try and treat you at C5-6. And I was listening, I'm just thinking huh? Like, what? Because I, like, at this point, I know enough about how the nerves work and, you know, all of the wiring of the neck. Like, and I'm just like, okay, so you're going to treat me at 5'6", which I spent, you know, a few years, well, I wasted a couple of years kind of going after, because I do have a disc bulge there. It is one of the most prominent things in any imaging I've ever had. And he's like, yeah, I think, you know, maybe if we can do a diagnostic block at 5'6", and then, like, we do have some treatments for degenerative discs, like with stem cells, and you can even go to Caymans, and like, I don't know, he was just giving me this stuff about 5'6", and I'm just thinking, like, what on earth are you thinking? Like, I didn't know what to think. So, but I just thought, like, okay, well, this is all, like, I didn't fight back on it. I said, okay, well, if I have to go to Denver and have him address my C5-6 joints to see if it, you know, if I would benefit from treating the disc that was you know, degenerative, then I would do it. Like, I just thought, okay, well, maybe this would work, or maybe it would help me a little bit, or and then part of me just thought maybe I'm just sort of letting him rule this out, you know, and I'm just going along with it because I really didn't believe in this. So anyways, this whole video is going to be like a rant, but okay. You're still here, so obviously you're enjoying the humor in it. So I flew off to Denver, and it was February, and it was 2021, so it was kind of still like weird COVID time, and it was snowing, and it was just really, it wasn't the most pleasant, but I went into the clinic, and I had the in-person visit with him, which was great. Like, he, as I said in the last video, the more in-person you can do, specifically with that clinic, but probably with any highly trained doctor, like, you're always going to get a better, in my opinion, you're going to get better service when you're there in front of them, and they can really hear, you know, what it is you're saying, and you know, if you need an extra couple minutes, they're not just going to walk away. Versus on the video calls where everything gets kind of compressed and they're very rushed and they want to just move on to the next thing, and they kind of lead the conversation and sometimes cut you off and stuff. So yeah, I had this good visit with him, and he said, and I brought with me in the room. So this is I was prepared. So I brought with me the diagnostic block that I had done, I guess at that point almost 3 years before, which was in Washington, D.C. with the guy that did the prolotherapy for me. So before I did prolotherapy, his approach was to do a temporary block with anesthetic, see if the pain was resolved, and then he knew that this was the right level of the spine, which is great. It's a more scientific way of approaching it rather than just hitting everything and hoping something sticks. So I had the printout of my procedure notes, and I printed them. So I was like, I don't want to rely on an email or, you know, showing on my phone or something. I literally printed the procedure notes from my diagnostic block at C12, and I printed my pain journal showing that this thing worked, and that if they could block the nerves and the whatever was going on at 1-2, like that fixed my issue. And so I brought that into the office visit with the doctor in Denver, who was about to do this C5-6 treatment or whatever. And so he looked at that and he's like, oh, when did you have this? And I was like, well, I had this like before I had the PICL, and I think I mentioned it, but it's okay. They have a lot of patients. I get it. And he's like, oh, he's like, this is really interesting. Oh, they did it under fluoroscopy. I didn't know anyone else. Well, he didn't say anyone else, but like, I think they do have a bit of an ego there, and it's understandable. I mean, they do world-class stuff that is not available in too many other places. So yeah, he was kind of a little impressed that I had this injection somewhere else, and that it appeared to be a bona fide, there was contrast dye used, there was fluoroscopy used. The joint was injected, as well as the medial branch of the C2 nerve root. And it worked. So to me, that was like, why are we going after 5-6? And he said, okay, let me make you a deal. We're going to do 5-6 today. And then can you come at 6:30 tomorrow morning? And I'm going to do a 1-2 block for you. And it's like, if one of them works, or if they both work, then we can come up with a treatment plan. So I'm like, okay, fine, sign me up, And I think he even might have managed to sort of bury the financing of it so that I wasn't paying twice, which is all I really cared about. I mean, they can inject whatever they want as long as I don't have to pay like over and over again for the same treatments. So anyway, so basically I was in Denver, kind of in between PICLs, and I was, he was just sort of giving me these diagnostic blocks to try and figure out like what was really going on. So I had I guess the C6 nerve root, or what I think it would be the C6 nerve root, injected bilaterally with a temporary anesthetic. And then I was sent back to the hotel with a pain journal, just like I'd had with many other procedures. And I would say I did notice I felt slightly better, like just having those nerves turned off, essentially, lower down on my neck. And so, I kept the pain thing, and I was like, okay, it was a little bit better. Like, all right, I'm more impressed than I thought I'd be. And then I got up at the crack of dawn, and there was a fresh snowstorm, and I had to like trudge through the snow from the hotel. I stayed at the hotel that's like right next to the clinic, so it wasn't that bad. But it was still, I live in California. I wasn't prepared to be walking through like a foot of snow. So I'm there at, I think it was like I got there at 6 a.m, and of course the door is locked, and I'm like, okay, I sure hope somebody gets here soon. He ended up getting stuck in a snowstorm, I guess. So. Or he was, the plow was in the way, or I don't know, they had something was going on. So I was waiting for a little bit, and my flight was like later that day. So he, long story short, he did my, occipital nerve block, which is the C2 nerve. The C2 nerve is the occipital nerve. So he did that, and then I had my pain journal, and, that fixed everything. So I'm like, okay, so now I've had, 3 years ago, I had a C2 occipital nerve block, and it fixed everything. And then the doctor in Denver did essentially the same thing, and it fixed everything. So, can you believe me now? Like, it's probably not 5-6, like at least not the majority of what's going on. And he's, he was like, yeah, okay. So then I said, okay, well, what do we do? And so the proposal was to do a hydrodissection of the occipital nerve, because I think his theory was that maybe my instability was not really the problem, like that there may be some instability, but maybe it's just the nerve is so, there were so many years of compression and, aggravation of the occipital nerve that it just needed to be kind of restored. And that if we could get the nerve to get better, then I would feel better. So it was kind of like treating the nerve rather than the instability as a whole. It was just treating one specific thing. So I did go back. I had to go, like, it had to be another trip, just because they didn't have any space on the schedule. So I went back like a month later. I had this hydrodissection procedure, which is PRP, and you're awake for it. It's a posterior injection, obviously, so fairly straightforward, at least for them. I mean, probably not anywhere else, but so yeah, I had the hydrodissection, which I believe they actually did under ultrasound. Easier to find the nerve and sort of because the nerve sort of goes through all the different layers of tissue and muscle, and so they try to insert the needle, alongside the nerve, and then sort of bathe it in the PRP, And they do that in a couple different parts, a couple different sections of the nerve. So yeah, so I had this treatment, and I was thinking like, okay, well, maybe this will fix me. Like maybe, the PICL combined with this special attention to the occipital nerve, which I was getting that day. And so I flew back, and I think it did help for a little bit. But like so many other things I've done, it didn't last. It went back to the way it was before within probably a couple weeks. So yeah, so that was kind of my, what I had tried between PICLs. And I think, I guess the last part of this video I can talk about is the opportunities to do a second PICL, and what I was thinking about when I made that decision, and what the doctor was, telling me, and then I think I can wrap it up, and I can talk more in the next video about what I did after the second PICL, because the story went on. So, okay, so I, just to recap, I guess, I had PICL 1, and I tried some of the chiropractic treatment just to give me something to do, I guess. I'd done the postural physical therapy that was recommended by the PICL people. I actually had another DMX as well. I don't think I mentioned that. That did show a small improvement, but we're talking like fractions of millimeters. So I wasn't sure how accurate this stuff can really be, but it did show numerically that it was improved. But unfortunately it wasn't the same provider. It was the one near me in Los Angeles. So I wasn't, again, I don't know if it was an apples to apples comparison. But I had another DMX, and it did show things looked slightly better, but not much. And then I'd done 2 other trips to Denver to do these sort of exploratory treatments, as well as getting the hydrodissection, which, was okay, but it didn't last. And I thought it was over. Like I wasn't, I had one more appointment on the books with the doctor there, and I was kind of expecting to just hear nothing, to just be told like, sorry, like nothing we're doing is working, and you're done, and good luck. And like I was fully prepared to have a phone call like that or a video call with the doctor like that. And I guess mentally I'd already kind of moved on, and was starting to just think about how I was going to adjust. And I was like, I don't know. I wasn't depressed about it or anything. I just felt like that chapter was closed. But anyway, so to wrap all this up, I had the call with him. And so this was about almost a year at this point after PICL 1. So I had this video visit, and, he comes on and it's like the usual, like, how are you doing? How are you feeling? And it's like, well, I feel the same, it's like, he said, do you feel worse? And I said, no, I don't. Like, maybe I'm like incrementally worse, but I don't, it's not like I've, fallen off a cliff or anything as far as symptoms and all that. Like, I feel the same, maybe slightly worse, definitely not better. I did not feel any better whatsoever. That there was no doubt that was the case. So if anything, I was slightly worse. And he said, okay, well, we can do another PICL if you are interested. And I was sort of like, oh, I wasn't expecting that to be offered to me. I just wasn't prepared to hear that, I guess. I didn't think that it would be an option, or that he would recommend that. He did seem pretty fair and pretty conservative, and I just thought, like, if he's telling me that, I think he's serious. He's not just doing it for the sake of, getting another procedure scheduled. Like, I think he really thought that maybe that a second one would work when the first one didn't, or maybe that they would build on each other or something. So what he did tell me, I guess, from what I remember of that call, is that he did believe that some of the people they've treated did not respond to the first one, and they don't know why, but did respond to a second one. So there was a precedent. This is what I was told, that there was a precedent for people like me that got nothing out of the first one and had benefits from the second. So that I should consider doing a second because I could be one of those people. I'm like, wow, okay, great. Like I like those odds, I guess, that's what I was thinking. And then he said, but I have to tell you that, because the PICL1 didn't work for you, the odds of PICL2 working are significantly lower. In other words, like your chances of doing better are just so much worse than they were the first time. But not zero, but basically your best shot was that first one and you failed. And the second one, it's the odds are against you. So, I don't think he said it had to be a miracle or something, but like that it really was much less likely to work. So he said to me, he's like, you're going to have to think about this. You don't have to decide right now. This is, my assistant's email, whatever. Talk to, your family or whoever you need to. And you'll have to really think about it if you want to spend the extra money and try this. And so, yeah, I appreciated the honesty, and got off the call, and I just thought to myself, like, no, I have to do this. Like, there's no question. I mean, I'm not going to have this opportunity again. There's no other place in the world that does PICL. I wasn't about to race off and get a fusion surgery, that's for sure. So I just thought, like, no, I have to do this. I didn't have to think very hard about it. I had the money, so not everyone is in that situation, and I'm very fortunate and realize that it's a privilege to be able to afford these treatments and not have to think too hard about it. So I contacted the scheduler, and I got myself scheduled, and the second PICL was, I think, almost exactly a year after the first. Which is a little longer than they normally space them, but because I wasn't responding to it, and then he was also trying to explore other possible issues that I may have had, there was more of a gap between the two procedures. And then the second one, I guess the other thing that was different about it is that I had the more advanced above and below the Atlas injections that they do. At the time, they didn't offer them for first-time PICL because some people have a harder recovery, or it had something to do with just your personal tolerance for the procedure. But I tolerated the first procedure just fine, and so he was going to give me the complex procedure for the second one, which I was told might also help my chances of it working and whatever. So I did a second PICL, and fortunately the price hadn't gone up too much, although I think it did go up a little bit. I hate to think what people are paying for it now with inflation and just the additional demand that they've probably had because of everyone finding out about the procedure. I mean, it's a fairly new procedure, although I think they've probably done well over 1,000 by now, but it was newer when I first did it. So yeah, I had the second procedure. It was, I knew what to expect. I was able to be very prepared for it, and it went well. I didn't have any issues. I don't even think I took the pain medication afterwards. Like I was like, I don't need to take opioids. Thank you very much. I did take the opioids after the first PICL just because I thought, like, I want to sort of follow the protocol, and I did take it. But the second one, I figured, like, I know, I've been through this. I know that I'm going to be okay. And I did also spend a little bit longer in Denver after the procedure because I thought that might help not traveling right away after getting it. It was just a guess on my part. So I did decide instead of flying at the earliest, recommended opportunity, I just was like, oh, I'm just going to spend another few days, not go anywhere, just relax. And so that was nice. So yeah, I had PICL number 2, and I think that's where I can wrap up this video. I've been yakking for long enough. Yeah, I mean, the PICL is, it's one of the great options that's available to CCI patients. Unfortunately for me and many others, it doesn't work. And nobody knows why. I mean, that's one of the issues with experimental treatment is it's just not, they haven't done enough of them, and it's all of this is privately funded, of course. It's not like NIH is funding, huge clinical trials of people getting this PICL. I mean, this is all literally just one clinic that's trying to do what they can on private money and, people paying for procedures. So yeah, I don't know. I don't know why it didn't work for me. I know that I'm not alone. There are other people. Some of them are more irate than I am about it. I don't feel angry about it at all. I feel like it was a good option, and it was cool to have 2 opportunities to see if it could work. Because if it did, like that could change my life, and I still have a long life to live. So it would have been worth, it was worth the attempt to try it and give it a fair chance by having it twice. I guess I'll close by saying that when I had the follow-up from the second one, it was an earlier fall. I think it was only 3 months or something. It was like I was expecting maybe at the first follow-up that it would just kind of be a progress thing. Like after my first PICL, I had a follow-up, and then he's like, well, let's do another call in a couple months. But no, I had the follow-up after my PICL 2. I believe it was 3 months. And the doctor came up, was like, how are you doing? Are you any better? I said, nope, 0, no better. And he's like, darn. And he said, I'm sorry, but I can't help you. It was very blunt, and hard to hear, really hard to hear, because I actually wasn't expecting. I was expecting, let's set up a call in 2 months, and then, maybe you can come back and we'll try this or that or whatever. But no, he was just brutally honest and said, like, I don't have anything else to offer you. Good luck, So I was initially quite floored by that after all I'd been through. And that, this is personal stuff. Like, CCI is such a big part of our lives, and we don't want it to be that way, but it is. And I just felt that it was a little cold at the time. But after I'd gotten over that shock factor and just not expecting that kind of call, I really think that it was for the best. Like, I think that he was being very ethical about how he was approaching my case, and that he had reached the end of what they are able to offer me, and doing anything else would just be taking my money and knowing that I'm not likely to get any benefit from it. So after having gotten over the emotional response to that follow-up, I really respect the guy. And I think, like, yeah, that's what I needed to hear. And that was the story of, the end of regenerative medicine for me. Was, it ultimately didn't work. I was very hopeful that it would, but that, I certainly wasn't, I wasn't going to push to get, a third one, especially after, he really kind of said, like, this, it's over, we're not going to do this anymore. And I supported it. I don't think it would have been a good decision to keep going. So So hopefully I haven't discouraged anyone from trying it. I mean, I'm not opposed to it. I think it's a great option. I think it does help people. If you get onto that Facebook group, you can meet other people that it has helped. I don't know that it's cured anybody. I don't think you can cure CCI, unless maybe if it's caught really early. But it's really helped people. But there are, a portion of people it doesn't help at all. I'm one of those people. So there is the risk that it's not gonna, you're not gonna respond to it, and you don't really know. It's a crapshoot. You really don't know how it's gonna end up. Yeah, that's the story. So the next video, I'm gonna talk about the path that I took after being written off by the regenerative medicine clinics. And some of the ways I looked at treating my symptoms rather than my CCI. So I went to more of a palliative care approach where I was just trying to make myself feel better rather than treating the problem. And that's a good place to stop. So I'll see you on the next one. Thanks for listening. And again, like the video. It helps with the algorithms and it will help more CCI people discover the video. And comment if you have anything you want to say about my experience, or if you think I'm being unusually harsh to the chiropractors. I mean, let me know. Like, everyone's entitled to their opinion. I am very open about mine, but it is only my opinion. Or if you want to share your PICL story, please do, and maybe it will help other people. It'll offer a more balanced kind of impression about the benefits of PICL. Yeah, we'll talk to you all on the next one. All right.